With meningitis, meninge refers to the meninges, which are three protective membranes that cover the brain and spinal cord. And itis refers to inflammation, so meningitis is an inflammation of the meninges. More specifically, it refers to inflammation of the two inner layers, which are called the leptomeninges. The outer layer of the meninges is the dura mater, the middle layer is the arachnoid mater, and the inner layer is the pia mater. These last two, the arachnoid and pia maters, are the leptomeninges. Between the leptomeninges, there's the subarachnoid space, which houses cerebrospinal fluid, or CSF. CSF is a clear, watery liquid which is pumped around the spinal cord and brain, cushioning them for impact and bathing them in nutrients. In 1 microliter or cubic millimeter, there are normally just a few white blood cells, up to 5. If we look at a bigger sample, like say a deciliter, then around 70% of those will be lymphocytes, 30% will be monocytes, and just a few will be polymorphonuclear cells, or PMNs, like neutrophils. That same volume will have some proteins in it as well, about 15 to 50 milligrams, as well as some glucose, about 45 to 100 milligrams, which is close to 2/3 of the glucose we'd find in the same volume of blood. The cerebrospinal fluid is held under just a little bit of pressure, below 200 millimeters of water, which is just under 15 millimeters of mercury, which is less than a fifth of the mean arterial pressure. Now, at any given time, there's about 150 milliliters of cerebrospinal fluid in the body, and this is constantly replenished, with around 500 milliliters of new cerebrospinal fluid produced every day, and the excess, or 500 minus 150, or 350, is absorbed into the blood. But for any nutrients to enter or leave the cerebrospinal fluid, and the brain itself for that matter, they have to go through the tightly regulated blood-brain barrier. The blood-brain barrier is a special name given to the blood vessels in the brain. That's because the endothelial cells in the blood vessels are so tightly bound to one another that they prevent leakage and only allow certain molecules to slip through them. Meningitis is the inflammation of the leptomeninges, which remember are the inner two membranes around the brain and spinal cord. It is not the inflammation of the brain itself. That's encephalitis. But sometimes they can happen together, and when that happens, it's called meningoencephalitis. So meningitis needs some kind of trigger for the inflammation. And this could be an autoimmune disease where the body attacks itself, like lupus, or the body having an adverse reaction to some medication, which can happen with intrathecal therapy, when medication is injected directly into the cerebrospinal fluid. But by far, infection is the most common trigger for meningitis across all age groups, like with the Neisseria meningitidis bacteria or herpes simplex virus. Now, there are two routes that an infection can take to reach the cerebrospinal fluid and leptomeninges. The first way is direct spread, which is when a pathogen gets inside the skull or spinal column, and then penetrates the meninges, eventually ending up in the cerebrospinal fluid. Sometimes the pathogen will have come through the overlying skin or up through the nose, but it's more likely that there's an anatomical defect to blame. For example, it could be a congenital defect, like spina bifida, or an acquired one like a skull fracture, where there might be cerebrospinal fluid leaking through the sinuses. The second way is hematogenous spread, which is when a pathogen enters the bloodstream and moves through the endothelial cells in the blood vessels that make up the blood-brain barrier, and get into the cerebrospinal fluid. To do this, the pathogens typically have to bind to surface receptors on the endothelial cells in order to get across. Otherwise, they have to find areas of damage or more vulnerable spots like the choroid plexus. Once the pathogen finds a way into the cerebrospinal fluid, it can start multiplying. Soon enough, the handful of white blood cells surveilling the cerebrospinal fluid identify the pathogen and release cytokines to recruit additional immune cells. Over time, a microliter of cerebrospinal fluid might go on to contain thousands of white blood cells, but any more than 5 usually defines meningitis. In most bacterial cases, there'll be above 100 white blood cells per microliter, and more than 90% polymorphonuclear cells. In most viral cases, there'll be 10 to 1,000 white blood cells, and over 50% lymphocytes and under 20% PMNs. In most fungal cases, there'll be 10 to 500 white blood cells, with over 50% being lymphocytes. In most cases of tuberculosis meningitis, there'll be 50 to 500 white blood cells, with over 80% being lymphocytes. The additional immune cells attract more fluid to the area and start causing local destruction as they try to control the infection. As a result, the cerebrospinal fluid